Now, let me go over the equity issue in health service in the United States. Well, the problem of equity in health service after Obamacare passed lessened, has lessened with healthcare reform, but still remains a problem in American society. It is especially true for individuals dependent on public health care, those without health insurance in both urban and rural poor, since healthcare may simply not be available where they live. Okay? Related to the equity issue is unequal geographic distribution of service. A major factor in obtaining adequate medical care for some people is the numerical shortage of physicians, as well as nurses serving patients in rural areas and urban slums. But most physicians prefer to practice in urbanized settings. 1 out of every 20 counties in the United States lacks physicians. And more than half of all counties do not have a pediatrician. There are also a few signs the distribution of physicians is beginning to improve. Okay? So that is encouraging. Well, another factor in the maldistribution of physicians is that of over-specialization. Over-specialization has reduced number of doctors engaged as general practitioners in primary care and family practice. Medical students often prefer to specialize because, well, they can focus on a narrower and more manageable body of knowledge. They can enjoy increased prestige and income afforded to their specialties. Now let me get into an overview of healthcare delivery. The existing healthcare delivery system in the United States is a conglomerate of health practitioners, agencies, and organizations, all of which operate more or less independently. The greatest portion of all patient service is provided in offices and clinics by physicians who sell their service on a fee-for-service or per capita fee basis in the managed care network, and followed by service provided by hospitals. But let's talk about official agencies. They include public organizations supported by tax funds. These official agencies support and conduct research, develop educational materials, protect the nation's health, and provide service designed to minimize public health problems. For example, CDC, National Institute of Health, and its sub-agencies operating under NIH and CDC. For example, the United States also has voluntary agencies. Okay? There are charitable organizations who solicit funds from the general public and use them to support medical research and to provide services for disease victims. Okay? And the provision of healthcare nowadays include generally 3 types of organizations. First is health maintenance organizations, or HMO, and the preferred provider organization, PPO. Okay, so what are HMOs? HMOs, they're managed care prepaid group practices. Individuals pay a monthly premium for comprehensive healthcare service. For PPOs, they're a relatively new form of managed care health organization. Employers who purchase group health insurance agree to send their employees to particular hospitals or doctors in return for discounts. And also we have allied health enterprises. There are manufacturers of pharmaceuticals and medical supplies and equipment, which plays a major role in research, development, and distribution of medical goods. Okay. And here we have a very simple chart about HMO versus PPO, a comparison of these two, managed care organizations. Again, to start, HMO stands for Health Maintenance Organization, and the coverage restricts patients to a particular group of physicians called a network. PPO is short for Preferred Provider Organization and allows patients to choose any physician they wish, either inside or outside of their network. HMOs and PPOs are both types of managed care, which is a way for insurers to help control costs. It sounds easy enough, but if there's one overall fact about health insurance, it is that there's always more to the story. With the basics in mind, we can dig into HMO versus PPO differences and learn which could be best option for you and your family. Okay? So health insurance and provider networks. Let's talk about network. A network is a group of healthcare providers that have contracted with an insurance company to offer discounted service. These networks typically include general physicians and specialists, such as dermatologists and the chiropractors. They may also include labs, x-rays, facilities, and providers of medical equipment. Now, what's the main difference between HMO and PPO? The biggest difference between HMO and PPO plan are, well, patients with a HMO must always first see their primary care provider. Okay, if your primary care provider can't treat the problem, they will refer you to an in-network specialist. With a PPO plan, you can see a specialist without a referral. However, there are exceptions for emergencies or routine care, in-network visits to a gynecologist or obstetrician. With an HMO plan, you must stay within your network of providers to receive coverage. Under a PPO plan, patients still have a network of providers, but they aren't restricted to seeing just those physicians. You have the freedom to visit any healthcare provider you wish. So what's the catch? Well, staying in your network with an HMO, you can expect the maximum insurance coverage for the service you receive according to your plan. Go outside of your network and your coverage disappears. With a PPO, you can visit doctors outside of your network and still get some coverage, but not as much as you would if you remain in your network. So because a PPO does not restrict you in your choice of physician, a PPO is the way to go, right? Well, not necessarily. There are many more things to consider when deciding between the two. Okay, and the first is the cost of health insurance. Okay, with the PPO, the trade-off of receiving a little bit of coverage outside of your network, okay, is usually a high monthly premium. An HMO offers no coverage outside of network, but patients typically enjoy lower premiums. Okay. Another thing is filing a claim. That's another major difference between an HMO and PPO. Is the amount of legwork it takes on both ends. With an HMO, patients do not need to file a claim because the insurance company pays the healthcare provider directly. Under a PPO, however, a patient must sometimes first pay out-of-network providers for any service received, and then file a claim for reimbursement from their insurance company. Okay. Another one is about filing a prescription. Just as HMO users are limited to a network for providers, the same is true for pharmacies. Patients must have prescriptions filled at in-network locations to receive coverage. PPOs, meanwhile, allow patients to fill a prescription almost anywhere. However, you may pay more for prescription drugs when using an out-of-network pharmacy. Okay. So to summarize, PPO requires a high premium in general, but gives patients more freedom. Yeah. And more lag work too. Okay, HMO kind of imposes a lot more restriction, relatively speaking, and the patients don't have as much freedom as receivers of PPO. But at the same time, kind of paperwork, the patients, care receivers of HMO is much less. Okay. Okay, let's move on. The traditional fee-for-service system is modeled on the principle of open market. High quality service and affordable price are supposed to result from competition among providers, right? Well, the system that we're having is not a good example of a competitive marketplace. The fundamental law states that when the supply of a product exceeds demand for it, prices should drop. Well, it does not apply to medicine, since doctors and hospitals effectively create their own demand and provide service at prices they set. Okay?